Live from the Washington, D.C. area, all empowered citizens need to know about intelligent use of resources, smart governance, inclusive communities, smart industry, and healthy, thriving urbanization. This is Smart Sustainability, the TV talk about shaping a sustainable future in the digital age with Nicolette DeVidar. Shutdowns, homeschooling, pandemic parenting, isolation, economic fears, loss of loved ones, stress and fears of all kinds have taken a toll on our mental health, in our work environment and at home. Substance abuse, domestic violence have spiked among many other issues that are messing with our minds. Something we need to talk about. Good evening, I'm Nicolette DeVidar. It's already December. We're officially in holiday season, and the year went by just like that. Unprecedented, difficult, positive in some ways and challenging in most others. The uncertainty prevails. The COVID-19 pandemic has created havoc in our existing world with no end in sight. Add to that the growing economic fears, the possibility of a looming second shutdown, restricted holiday season, and a world that almost no one recognizes anymore. What we get is an explosive mix that is hard to mentally cope with, particularly since we've got accustomed to a rather linear and, for the most part, orderly life for the past 70 years. Now, COVID-19 took everyone to a different space. We're mentally, emotionally, and physically stretched. Many pillars of our society that provided some sort of certainty have broken and are still breaking away as we speak. Boundaries in the world we used to operate in have been dissolved, putting our personal and collective belief systems heavily under strain. Most people, most of us in general, are not accustomed to deal with that kind of stress. So how do we cope with all of this and adjust? In a Kaiser Foundation conducted poll in July, 53% of adults reported that their mental health has been negatively impacted due to worry and stress. This is over 20% higher than was reported back in March this year. 36% mentioned difficulty in sleeping or eating. 32% increased their alcohol consumption. And if you look at how easily people are losing it on the road, in workplaces, or at home, there's no denying that we're hitting a mental wall. So let's talk about what to look out for and how to cope so we feel more equipped to deal with this and less afraid of what's to come. My guests tonight are Dr. Hafsa Imam, a medical doctor and public health expert with a focus on pandemics. She's also host of TBN Wellness, a TV show on the Bangladeshi-American channel TBN. Dr. Lenia Ahmed Kiki, she's mass care manager with the Red Cross in Long Island, New York, which is a hotspot, as you know. She's actively deployed in all practical aspects of COVID-19, focusing on team training as well as taking care of masses of people, except that unfortunately she just informed us about 5 minutes ago that she was called off to an emergency. And we have Dr. Syed Mahtab Ahmed, staff psychiatrist for the Veteran Affairs Medical Center in Washington, D.C. And here with us in the studio, there is Nody Rashi, president and trustee of Walk for Serenity Foundation in McLean, where she conducts research in alternative medical solutions to address mental well-being. Thank you so much for all of you to join us. As you can see, we have Hafsa and Syed are joining us via Zoom, and Nody is here in the studio.
Thank you for having us.
This is a really super interesting topic, and as we all know, it's really growing. The winter is coming, we're in holiday season, there's many things that are happening. So let's talk about currently what is happening out there and what has happened in the last 6 months that really affected our mental health state. And I wanted to talk with you, Nody, because you can give us sort of an overview, like the bird's eye view. What do you see? What has happened?
So, if you really look at us as human beings, what we really always want is certainty. Mm-hmm. We really want to know, we want to feel like we have control what's going on in our life. And like we know what's going to happen tomorrow morning. We want to know what's happening with our life, with our kids, work, all the things. And what's happening after COVID hit us, the pandemic hit us, we really faced the reality, which was really the reality even before the COVID, which is we really don't have any control on our life because life goes on its own way. We really don't know what's going to happen tomorrow morning. But we wish to know, or we think that we know. So since COVID hit and since the pandemic, we are realizing what is the current normal for us. The things that we used to do, like, we used to dress up, go to work, or send our kids to school, hang out with friends. Now those are like things that we take it for granted, as if like that's life. And when we see that's not it, it's suddenly hit us like, oh my God.
Yeah, but that's already like what hits us. But what did you see in terms of what are kind of main stressors right now that we've been seeing growing in the last 6 months?
So first stressors is like we don't have that normal routine, like, waking up, going to work, send kids to school. So that's the first thing that hit us. Then another thing that's really have been really hard for all of us across the world is kids are no longer going to school. So parents not only have to balance with their work, now they have to be the teacher as well. And like, being at home with each other all the time, either we are finding ways to like each other more, or our bond is more stronger, or we see that like we've been paying attention to other things and our relationship is not as strong as it should have been. So it's an opportunity. At the same time, that's why we see a lot of like, domestic violence and a lot of things has been increased, and substance use, all those things has increased. At the same time, this is an opportunity for us to really look at it and then, find ways to be innovative and really set what the priorities for our life.
Oh, absolutely. I totally agree. So I wanted to ask Hafsa, actually, because Hafsa, you have a television show that is dedicated to coping with mental stress of COVID. I wanted to talk to Dr. Imam, the lady. I guess we can't see her on Zoom right now.
Can hear you.
Here we go. Good. So you have a television show that's dedicated to coping with mental stress of COVID, right? What were the main questions that your audience, your viewers hit you with in the past 6 months? What were like the main 2 or 3 topics?
Yeah. Thank you, Nicolette, for inviting me, and thank you for asking the question. If I go along with the question from the beginning, I started from the beginning of pandemic, that's April, now it's November, so it's been 8 months. And I can tell you, like, the question changed time to time, the most common question, but the most question has the same thing at the background, that's about people's security. So when the show started, it was all about like how they can protect themselves and how they can protect their friends and families from this infection. Like especially I was dealing with people of New York community, the epicenter of this pandemic in United States, So like I was getting call every day in the show, like people were asking like in New York, as we all know, like people live in a very densely community and in house and apartment, like most of the apartment, they live like 3 generations people in one small apartment, So probably one person was getting infected. So they were trying to help the family member. At the same time, they were scared, like how they can protect themselves too. So that was initially that was the most commonly asked question, like how they can protect themselves and the family member at the same time. But nowadays, the most commonly asked question is reinfection. As we all know, like many people cured already, but they are concerned about their safety again, like if they are secured, if they are not maintaining social distancing or they are not wearing masks. And also now we are getting lots of questions about the vaccine too.
Are you getting any questions about the mental health aspect as well?
Oh, yeah, sure. That's not the question. I think that was the basic of the whole show, because as I shared with you before the show, like we all started this show with the feeling like to reach out the community with support so people can feel strong mentally and people can feel like protected somehow and they can fight back this pandemic with mental strength. That was the main motive to start this show, actually. So every single show, we were experiencing so many calls. Like initially, it was like 1.5 hour show, and we were getting like probably 20 to 30 calls, and like everybody were asking, like it was mostly about their insecure feelings. Like they were trying to cope with the situation, but they were struggling to feel normal. Like even though everybody was trying to help each other at the same time, but everybody was so anxious. It was mostly anxiety all the time. People cannot sleep properly, people cannot eat properly, everybody was feeling out of themselves. And I think it was all through last 6 months up to August. But since September, we started experiencing the cases were going down. I think situations were changing a little normal. I shouldn't say like quite normal, but little normal. And nowadays you can see like people, we are using another new term, which we are saying like COVID fatigue. So I can say like you can also feel like sometimes we see like maybe people are feeling like giving up, but at the same time, now my show is focusing on like, motivating people not to give up, just to stay patient and be wise, because the vaccine is there. So we still need to be patient, and we have to deal wisely.
Yeah. Now, Syed, you work mainly with veterans, right? Syed?
It's not mainly with the veterans. I do have private practice setting as well. So yes, But
are veterans affected differently? And the reason why I'm asking is because veterans very often have already some additional experiences in that. So there is PTSD, there may be some other traumatic events or whatsoever. Are they dealing with this right now mentally differently than other people?
Well, it may not be differently, but I would say rather more frequently. Why I'm saying that is that by definition, the PTSD folks have gone through tremendous stresses, which unfortunately is lifelong, waxing and waning in time. Therefore, although the nature and magnitude of this COVID and their issues relating to the diagnosis of PTSD are different, nonetheless, they are causing anxiety. Sure. Are they doing or responding or reacting to that differently? As I already said, it may not be differently by nature, but in frequency for sure.
So let me ask you, actually the question goes to all three of you in this case. We heard that people cannot sleep, and Hafsa mentioned that too. So people cannot sleep. There are issues with eating and with sleeping. What is the main reason for the sleeping problems that people have? Is it the fear of dying? Is it the fear of, there's got to be more than just uncertainty. What is it? Go ahead.
So I think it's really like, when you are anxious, when you have all those restlessness and you are not really hopeful what's happening, when you don't know, so those things makes you agitated, right? It makes you restless. It makes you worried some. So when you have all this monkey mind, things are going, and also if you keep looking at the news and keep seeing what's going on, and also the pandemic fatigue that everybody's talking about, all those things really, and because we really don't have to go to work, kids don't have to go to school, so we don't have those sleeping pattern as well. Like, the way you used to go to sleep and when we used to wake up. So all these things, I think, adds up for not having good sleep, and then, it's a routine and keep making other things complicated for us as well. So if Dr. Syed wants to add some more.
Yes, Dr. Syed, you looked like you wanted to add something.
You're right. Let me add something. I'm well stated, though, obviously. Here is how I want to put it. In psychiatry, there are broad categories of named illness, and one of them is depression. And what the depression means, there are a certain set of symptoms, and sleeplessness is one of those symptoms. So to begin with, sleep disturbance is a symptom of depression. Now, why it is happening, how and why? The reason is, what is the most fear factor for us, for human? That most fear factor is the unknown. Whenever there is stress, we are scared of what is going to happen as a result of that stressful stimulus or situation. COVID, by any measure, as far as we know of our generation, of this century, is the biggest stress factor. And it is a new disease entity to begin with. That means that we really did not know anything when it came months ago, although we started to know something day by day. So going back to the point of the most fear factor is the unknown. And what is going to be the result of this COVID devastation, we don't know. That is the fear factor that is causing all the symptoms, including the sleep disturbances. And the mechanism or chemicals behind that manifestation of sleep disturbances is a completely different chapter, and I don't think we need to go to that aspect now.
Do people, now you work with veterans, but you also have a private practice. Now, when people come to you and clients work with you, and you ask them, do actually most of them, could they answer what exactly the specific fear is? Or is it more like a general, how should I say that? It's just, it's because of COVID or whatsoever. So what I'm getting to is, are people aware of what actually they really are afraid of? Can they name it?
Well, the fear is, for most part, generic, what is going to be because of the COVID. There is some specific issues as well, which is basically the secondary effect of COVID. What that primary and the secondary effect I mean is, COVID is a devastating disease or illness, at least at the beginning of the year when it really started affecting the whole world. Death rate was high, people suffering a lot, although by this time it has, rather manageable. So what COVID is going to do to me was, in general, the primary manifestation of the COVID fear. What the secondary effect of that is, as a result of the COVID, there are many social effects like losing the job, losing the earning, keeping themselves isolated, away from the family and friends, and so on and so forth. And all of those factors by themselves, whether they are related to COVID or not to begin with, are good enough cause to cause depression and anxiety. Now, when people come to me and talk about their fear or anxiety or depression, do they always correlate and pinpoint that this is because of the COVID I'm going through this? In many cases, the answer is yes. But in some cases, they cannot connect the dot between why they are going through these symptoms versus, what the symptoms are they're going through versus why these symptoms coming from. With careful interview and in-depth analysis, in cases that is related to COVID, it comes out that they were doing fine, did not have any psychiatric issue to the point of coming to the professionals. But since the period of March, April, May, they started feeling some sort of unusual features or symptoms, which they never had that. So by that, we can connect and can tell them this probably is the case. And addressing those issues by means of psychotherapy as well as medication management, oftentimes, definitely not in every single cases, we see the improvement. Thereby, retrospectively, we can see and say that yes, your suffering, mental suffering at this time is likely because of the COVID.
Hafsa, in your program and in your dealing with people, is there a specific, what's sort of like the main three things that are happening? Or is it like that suicide rates are going up? Is it like that depression is going up? Is it like anxiety? What is, can you give us sort of, if you had to rank it, what would be the order of that?
Yeah, if I can mention like four major things, I should say, like second to Dr. Syed, like the number one thing is dealing with like the fear of unknown. Like when people don't know what's going on, that's the number one thing. I can summarize everything under that. And then uncertainty, for sure, in all possible ways, insecurity in every single respect, like, security of your life, and then economical perspective, like people job and education and everything shut down over the night. And then at the end, like isolation. So I think that's the main four sector I can divide every single thing. Like we get complaint from patients every day in the show. And then again, like there were situations, like I should say, like as you were asking, like what is the common reason I was experiencing people sleep insomnia. So I think if I say from my experience, people were getting like panic attack, like definitely panic attack, because over the night everything changed. And like with shutdown, so many people lost their job, and there are so many families, like probably one family is surviving in one person's job. If you look at New York data, like with closing of all the restaurants and all the like day-to-day work, like, oh my God, that's like devastating situations there at that time, And like we were trying to providing all sorts of informations, not only like telemedicine, even like we were providing like where they can go to receive the emergency service for health and other chronic disease situations and everything. Because in New York, like that time, like primary care physician and walk-in, everything closed down, and they were converting to online. And many people, like elderly and so many people, like they live alone and they have no one to help. They even don't know like how they can reach or access those facilities, So we were actually trying to reach all the informations there. And with that, I should say, like the major thing was feeling helpless, feeling isolated, and feeling lack of support, like with all the sudden changes.
I want to talk about something very specific, because I think there's a difference between what is an existential, perceived as an existential threat, and perceived as a fear factor that is more like based on an old experience which just has been triggered. And I think there is a difference. So even for our viewers at home, I think I want to talk about this a little bit, so we actually get more tools or better equipped in dealing with when is actually a threat an existential threat to you, and when is a threat something that is based on an old experience or simply of the unknown, because not everything unknown is an existential threat. So when you have, for example, a business and you don't know, your business is going to shut down. And now many businesses that we have right now, they are really desperately wondering what's going to happen, because in case if there is another shutdown, most of the smaller businesses, at least, they say that the ones that survived the first shutdown are likely not going to survive a second shutdown. So yes, this is a direct existential threat, right? But then with the other part is just fear of the unknown, and people are differently affected by that. So how can we differentiate or become more aware or get some more tools in kind of diving in and sort this out a little bit on a mental level, each of ourselves, so to speak, when something is really existential and when something is just a fear factor because you speculate on things? Do you want to take a stab at this? Who wants to take a stab at this? Hafsa?
Yeah, can you explain a little more?
Yeah. So when something is, for example, when something is an existential threat. So let's say you have a business and you know there's a shutdown, and you probably have like very limited amount of cash in the bank. That's a direct existential threat, right? So that person knows here's something that affects me directly, and it's something you have to cope with. There are other people who are employed, they have a fixed job, they work from home, they have smaller changes, so they are afraid of something that may happen, but you can't really qualify it. But you still have in your mind, it kind of nags on you. So is there something that you could share that can equip people in differentiating when something is really existential versus something that is just a fear that may be playing in your mind?
I guess also because before she says, I guess also like what happens is like most of the people we are seeing get affected are either they already have some things, some existential uncertainties or some problems they already had it, or some people started experiencing it during the pandemic. So yeah, Hafsa, I would add also, Hafsa.
Yeah, I think when we know the cause, in summary, I can say when we know the cause, so we can plan how to work on it. But when we do not know the causative agent, why is this happening? So we cannot plan thing according to that. So I think situations also follows that thing from other aspect too. So people were overwhelmed with the changes in life. And as I said, isolation probably was overwhelming people thinking capacity. So I think everything together was changing even our normal output, what we can do in a normal state. Probably we were not capable of doing under this extreme stressor situation. That's what I think.
Mm-hmm. Syed, what happens in people's minds or in people's brains, so to speak, that causes mental stress? From a medical perspective?
Well, here is the thing. I think the issue at this point, what we are discussing now is if I face someone who is, for example, afraid of losing business as a result of COVID, right? Mm-hmm. Well, in this situation, I will emphasize on three things. One is, I will say, did you face similar or close to the same situation what you are facing now? Look into that and see, could you successfully overcome this? Mm-hmm. In overwhelming majority of cases, they will definitely find something that they had difficulty and could successfully overcome and solve that. I will capitalize on that and tell them that keep on trying, be faithful to yourself, and you will succeed, and you will overcome this time as well. Second thing, what I tell my client is that, can I live without this? Or what would be the worst possible scenario as a consequence of this crisis? What is the worst possible scenario, and is that going to kill me? Again, overwhelming majority of the cases, the answer is no. It is not going to kill me. Well, if so, why you are so devastated now? Thereby giving that moral boost. And finally, in situation like this, the COVID, the equally important thing is to let them understand that you are not alone. Mm-hmm. I'm just one of the overwhelming majority of the world population. So I should not be crippled by thinking and worrying that I'm going to lose something really significant. Well, I'm not trying to minimize your loss, but I'm trying to say that you can overcome that, keeping yourself strength, capitalizing on your past success.
I guess this is very important.
I think so too. This is very important. Actually, we had originally planned to go into the break, but I'm going to cut the break because I think we have so much more to cover of real information for you at home and also for us in the studio that I just want to keep going. I think that was really a good point, and I really hope everyone picked up on that because I think that is so important to understand.
Collectively, when we know that we are not alone,
Yes.
that makes a huge difference. Like, I'm not the only one who is really going through this. There are other people. When we can connect with others and then take inspiration from it, I think it also helps. And another thing, how they said it, like trying to be present, trying to solve what you can rather than not worrying about what you cannot.
And work through it and really see, is this actually going to kill me? And yes, Syed is right. In most cases, it's not.
It's not. And there are always, that's what people say is necessity is the mother of invention. So when you have a problem, that's when you become creative and find different solutions. So I guess that's another thing also, that we can look at it positively. And, trying to be present, that's why people keep asking for mindfulness and all those different kind of practices, because when you try to stay present, then you are just looking at something just in front of you right now. There are problems that you can maybe solve right now. There are problems that you can solve after a week. So there is no point of worrying about something. Of course, we should be prepared. And as Hafsa was also saying, this is, it happened after 100 years. So we are not really prepared for all this isolation and the way we are coping in the beginning. But then if you really look at us as, collective, all of us, we are better prepared to, even if the next shutdown comes in, or how can we protect ourselves. Now we know more because now it's in our knowledge.
Yep. I actually want to talk a little bit about change. So I hope we can get Syed back on the screen here. I would like to talk a little bit about why are people so afraid of change? Because when you really look at this, what it means basically is that our mental model is challenged, right? That's what it is, if you really look at it. I used to work as a change agent in organizations, and by the mere name that something was changing, 95% of people would go immediately into resistance, just literally having all their hair stick up and being afraid of the unknown. But I want to dig a little deeper as to why do we actually do this? What is this natural instinct? And where is it coming from to just be afraid every time when there is change? And most people have that, not everyone, but I think it depends on how many changes you've already been through and how many, as Syed said at the beginning also, in terms of how you've coped with previous changes and things like that. But what is really the underlying, how should I get this underlying factor of why we're so afraid of change? Are we so stuck in our mental models? Syed?
Well, here's the thing. Why we are afraid of change is explained in the phrase, we are afraid of the unknown. We know the current situation. We know the present. We are used to the present. What is going to be as a result of change is in the domain of unknown. So the fact that we are afraid and reluctant to adapt the change is because we don't know what are going to face. Therefore, the other side of that same coin, that most fearful factor is the unknown, by extension, the change. The other side of that coin is knowledge is the power. What changes we are going to bring or to face, if we can carefully, objectively analyze the result of those forthcoming change, that will minimize our fear. And therefore, with any institution, for example, when there is a need and need of changes in their policy, the employees get scared Therefore, the management's responsibility, for example, in that particular given scenario, is to explain that this is what we are going to bring change, expecting that it will bring this and that benefits. That comforts the employee, minimizing their fear.
Mm-hmm. That's definitely, I think, a major factor.
I think that the main thing is like we like to be comforting in where we are. So because we always have been seeing other people, how our mothers raised us is kind of like the way we want to raise our children, right? Mm-hmm. So there are like familiarity. We are very used to a familiarity that gives us comfort. Anytime there is a different thing, unfamiliar things, that gives you discomfort. So that's why we are kind of like fear of all these changes. But at the same time, you cannot really say everybody does it. You will see anytime there is a change, a lot of new invention comes in, new opportunities shows up. People become more creative.
Yes, they do. But I want to get back to this. So wouldn't that be fair to say that when you're very afraid of change, or when many things change around you, that is deeply connected to your own distrust in yourself? Because when you really trust in yourself, and you know you can adapt to any environment at any point of time, then you're definitely less affected by change than other people. So what I'm getting to is, to what extent, should the question be, do we all need to work on our trust in ourselves, trust in life, and also on our self-esteem? Is that the major issue? Hafsa, Syed?
So I think, like next to, second to Dr. Syed, I would say like in our shows, so we were also giving suggestion to the patients, the same thing, like we need to strongly believe that we are all in this together, so that peer group support actually make everything feels easier. Like if you compare now with the starting during March and April, like it's a lot more easier now. People are taking things like naturally now, right? And at the same time, like we need to understand that nothing is more precious than our own life. So when we have like the healthy state of health and body and mind both, so we can plan and we can deal with every single challenge. So as you said, like why we are so afraid of change, I think that's human being. Most of the people, they want to stay at their comfort zone, as Nody mentioned. And like from there, I think we frighten initially to deal with changes, but I think this is humane to adapt and to cope with the changes, So we go through like adjustment disorder, and we struggle, and then we adjust and we success also, And I also think like this is a time, like when we go through extreme crisis, we need to redefine the definition of success, and we need to redefine the goal. So while going through a crisis like pandemic, we need to redefine the definition of success. And I think for this pandemic time, the definition of our success should be stay alive and stay healthy, So when we will get through this pandemic, then we will always dare to plan for something new beginning in a bigger state.
No, do you have something to add?
I like, how you were saying is like, I think the reason that we are, like you said, do we not trust ourselves? The thing is because we have a very set life. We really don't go through like the emotional resilience. To build up emotional resilience, you'd have to go through a lot of different kind of changes. But if you really look at the Western world, we have a very set life.
It's very
linear.
Yeah.
Very set life.
Yeah,
so because
linear.
People do not go through a lot of different kind of challenges, so like if you really look at a lot of those countries, like, where people go through, like third world countries, where people go through a lot of changes, I know because I worked in slums when I was in Bangladesh. In Bangladesh, in the slum areas, there are not many people are not afraid of COVID, and they did not get affected as much either. And then, they were, because they had other challenges going on, then the challenges, They are not worried because they live like, maybe 10 people in 2 rooms. So when people have different kind of challenges, so they kind of like always look for tiny things they can hold on to and then come out of it. So they are more hopeful. They are more emotionally resilient, which maybe a lot of people in Western world, we kind of like lack on it. But then I guess this time, these 9 months taught us a lot of things. And I see more positivity than like, I see that we are going to come out stronger as human species,
Oh, I totally agree. But that actually also brings up a point that I want to ask Syed. So the upbringing, obviously, as you just mentioned, Nody, plays a different role. Cultures also play a different role. And I know Syed has spent some time, I think, in Japan, for example. I wanted to ask him, so how are people from different countries and different backgrounds affected differently in their mind because they address it differently? Syed,
Thank you very much for bringing up that topic. Excuse me. But before I speak on that, let me mention 2 points about what we just spoken about the changes and the positive effect of the unfavorable scenario. About the changes I want to add, I already explained how it happens, but how to face with that, the most important tool will be like this, that the world has been ever changing every single day. And from ancient time up until now, as a result of that ongoing changes, we are here in a modern world as a result of those ongoing changes. So it has for the betterment of human being. Sooner and the better we can accept that change, better off we are. This change will come whether or not we agree with that, whether or not we accept them easily. It is ongoing changes. Therefore, embracing the good changes is definitely for our own betterment. The second thing is, what is the outcome or the positivity of any unfavorable circumstances? Nody also already mentioned that what happened in Bangladesh, and as a matter of fact, I was listening to a talk show just today, and they were mentioning about the acceptance of the COVID vaccine by the American and Canadian people. The good thing is that a country like Bangladesh, a developing country, have much more material difficulties and hardship than the first world countries. For example, a concrete example is mass immunization, including the cholera, including the smallpox. And because our generation faced and went through that, this generation or the subsequent generation of Bangladesh are much more mentally equipped to accept the COVID vaccine as well, compared to the folks who did not go through such mass vaccinations. So that is the positivity. Another positive aspect of the COVID is, obviously, it has lot tremendous negative impact. What is the good thing? A byproduct of that is, as a result of isolation, we are having much more quality family time. So just that was the previous issue. Now, let me talk about the issue of the Japan issue and how it relates to this COVID topic. In the absence of proper and effective vaccination for COVID, mask is said to be secondary to vaccine, according to Dr. Fauci. Is this true? Is this just belief, or it has some really objective measure? It does have objective measure. Japan is the prime example. Japan uses it, the mask, you can say for practical purpose, 100%. Why? Because of their mindset. We the Western people now know about the mask in general for common use by the discovery of the COVID. While mask use is common from historical period. I was there for a long 12 years.
Yeah, but they generally, because they live in much tighter quarters, particularly in Japan. I mean, they live in literal shoeboxes of the size of a shoebox. So they're more adapted to use of masks. That is true.
It is definitely one of the reasons. It is not the only reason. More of the respect to others, more of the faith in science. What that means, we all know that there are certain illnesses which are airborne, and common flu is one of them. So this is science, and they believe in it, and the prevention of that is using masks. What is the respect to others? Well, I know if I have that common flu, I'm prone to spread that. By doing so, I am violating others' right. And therefore, being respectful to others, they use that. That's the other reason. The third reason, as you mentioned, is the crowded society. Yes, definitely, that's another factor. But I would like to bring two other nations in this scenario. I have been to China as well, and I have a good number of Chinese friends as well. China is not a crowded country. And the use of masks, although is not as widespread as in Japan, but much more.
Yeah, but what I'm getting to is actually something else. I don't want to debate about the mask use or not, because there's different views on that, and no, there is no clear science on it. The countries are very widely spread on that. So that's the one thing. But what I was getting to is that obviously there are other things in the upbringing that play a role in how we mentally deal with it from a mental health. I don't want to talk about the practical things, but from a mental perspective, yes, the mindset is different, but when you look at how some countries, like in Japan, even organizationally, I mean, they're used to working in a very different team environment than the rest of us, and it works over there, but it doesn't work over here. So I don't think there is like a clear cut, but what I was getting to is, to what effect actually does the cultural upbringing play a role on our mental health in how we deal with the impact of COVID?
Well, in the context of the COVID and mask, I would say it is the respect to the others, that me not, for example, not using the mask is affecting others. And also, just yesterday, I read an article as well, just on that particular issue. And what they mentioned is that.
But we're not talking about the mask. I want to know the impact on the mental health, not the mask.
Well, I do not have really data on the mental health effect of COVID on Japanese population, but I'm pretty much sure that it is increasing as well. Okay,
so it does play a factor in the mental health. I mean, as you said, with resiliency, for example, particularly.
Exactly. So, and also, like, I think is like what you're getting into is like, because you know how you grew up, your culture.
Yes.
It really, because you're emotional, that's how you're like, you know, how you are being affected by mental health is how emotionally resilient you are.
Yes, you are, because that also plays in terms of how much of a risk taker are you? How do you see life in general? How do you go about it, right?
Exactly.
If you're a risk taker, then likely you're not going to be mentally affected as much as others who are not.
And also, like, you know, if you're emotionally resilient, then you're not going to get affected. You're not going to get affected by all the anxiety as much as all the uncertainty or fear or all those things as much as other people. So that's why I think one of the things is like people who grew up in a very sound family environment have good bonding, you know, parents and because, you know, most of the things, you know, my research showed me most of the things that we are like how I am gonna be, how we are today, most of the things are done first 7 years and then even before we are teen. The skeleton is done by then. So that means my caregiver, my guardian, my loved ones, they shaped me. So that's why you will see even kids who have mental health issues if their parents have mental health issues. It's not only genetic, but also because that's what they grew up with. So because like I move my hand a lot. That means I taught, my mom does that. So, you get to learn a lot of things from your environment.
Yeah.
So if you have a solid, upbringing where you are loved, you have a community, you are gonna have a better mental health issues as you grew up. If we don't have that solid background, that community support and friends, then we are gonna have more affected by it. So, if...
Absolutely.
I agree, and thank you for clarification.
Yeah. With that, I think I also want to add, behind this stress and anxiety, the mental aspects also play a huge role, but also from medical science, as we all know, this virus, COVID virus, it has different strains. Like there are 4 major strains, and different strains actually hit different area of the world.
Yeah.
And as we know, North America got affected by a very strong strain, which was causing huge amount of death. And if we also compare with Asia or Southeast Asia, so we can see in those areas, people are exposed to germs and microorganisms and infection in majority part, most of the time, comparing to here, So there, our body immunity also play a huge role. In those areas, people are immune. And we already had different types of coronavirus infection in those areas many times before, not like COVID-19, but different sorts of coronavirus. And from there, we are thinking probably there people are immune in some form of way to coronavirus for other strains, So they are fighting back in some other way, which here people fail to fight back because here people probably were not exposed to those virus, those type of infection before.
Yeah.
So that also play a big role actually. And when we see all my known people are getting infected, I'm losing so many known people, obviously that will affect the mind too, no matter how much strong I am. When I see my country or my area is affecting in a different way, we are losing probably highest number of people, obviously that will scare me too. If I share my personal experience, my husband, he is a frontliner too. So he is one of the frontliner in one of the epicenter in Connecticut. So I was seeing every day they were dealing around 300 to 400 people. And we started living in separate because of the isolation and quarantine and everything. And even listening the stories from him every day as a frontliner.
Yep.
I was getting panic attack every day. I have to admit it, So no matter how much mentally strong I am, no matter how much educated I am, nothing works that time when I'm seeing death every day, and there is no way we were capable of fighting that back that time,
So Hafsa, I wanted to ask you something else about history and pandemics. What do we need to know in terms of how our response today is actually different and in many ways a lot more effective than it was in previous pandemics throughout history?
Oh yeah, thank you, Nicole. Thank you for asking. That's really a great question. So that was one of the things I was discussing in my shows to encourage people, how much blessed nowadays we are today. Because if we look back to the pandemic history, as we all know, major pandemic actually hit this world on average every 100 years. So if we start with plague, plague hit her around 1720, but it started actually around 1300, and it was there more than 300 years, and we lost more than half of the people of Europe due to plague. And even we couldn't get any treatment or anything for 400 years around, and then around beginning of 1700 we invented antibiotic. Again, around 1820 we got cholera pandemic. It started in Asia. Also, we lost more than 100,000 people for cholera. And then we had the worst pandemic of history, which is Spanish flu during 1918, which was there for 3 years. And, due to Spanish flu, we got infected more than 500 million people, and we lost more than 100 million people in Spanish flu. And now we got COVID on December 27, 2019. And it affected around 35 million so far, and we lost more than 1.5 million people so far. But the good thing is, if we compare the pandemic history, like if we look at plague, it was there for 400 years, and we were helpless. We couldn't understand what was the reason and how it was causing. We only know the transmission, so people were trying to get rid of the transmission, like they were killing rats.
We only have 2 minutes left, so I do want to speed this up here a little bit. You mentioned at first when we spoke what makes this different, and you said because we have a much more connected world and information spreads faster. So where is it? Let's talk in the last 2 minutes about what can people do to actually find more information, get some training, get more knowledge on it, and get some help. So let's go about this. Where do they find training and really good information other than the CDC page?
For the COVID. Okay, Nody, you can go first.
So I would say, there are all, except CDC, there is a website, Very Well Mind. That's a very good website. It tells you a lot of things that you can, the symptoms you can, and the precautions you can do. I would tell people to practice gratitude, really helpful, write it down. Don't just think about what I'm gratitude for, at least 3 gratitude things and I saw a lot of places practice that.
Yeah.
There is emotional freedom technique that you can try, do it, a lot of, things online. You can just get those and practice at home. Emotional freedom technique, energy therapy, mindfulness, yoga. Those are
and that's
very
really
basic.
to make you more stable and increase your presence.
And also emotional resilience as well.
Are there any other pages or sources that people can go to that you would recommend?
I would like to share something else to create support system. I should request everyone just be wise, because we get through this pandemic. It's almost like a year now, and we know vaccine is there. So we have to be wise. We need to be more patient, and we need to wait a little more. And we need to believe in science, and we need to participate in the vaccination. And also, we know there is another pandemic we are expecting following this one, which is mental health crisis. So we need to be connected, and we need to support each other at our best.
That sounds great. Syed, do you have one last word? It has to be quick.
Sure. It's simple that knowledge is the power, and because this is the age of communication, obviously there is widespread information, but we should be careful to separate the fact.
And this is it. So thank you so much for being with us and watching us tonight. And if you do need more information, I invite you to go to our Facebook page, actually Smart Sustainability TV, or also my page, and you can find out more. Thanks so much. Have a wonderful night. Thank you so much to all 3 of you. It was great.
A lot of great discussion.
Thank you.